Hello, everyone. Welcome to another episode of Health Tech with Purpose podcast. Our today's guest is Deepthi Bathina, founder and CEO of RhythmX AI, joining us on the show. Deepthi brings a wealth of experience from both the healthcare and technology industries, and she's passionate about using AI to improve patient care. Join us on this episode as Deepthi shares her story and the innovative ways AI is transforming healthcare. Hi, Deepthi. Welcome to today's podcast. Hope you are doing great. We are very excited for this recording this episode, and the work that you are doing, makes us really interested to know more about your journey and the impact that you're creating in health. So, welcome to Health Tech with Purpose podcast. How are you today?
Very good. Thanks, Ayush. So glad to be here. I've seen your other podcasts and you're having very interesting conversation with some transformative companies. So honored to be here. Thank you.
Great. Yeah, welcome and thanks for the kind words. Deepthi, why not we start with a bit of background? We would like to hear your story and, like where did you start? What were your beginnings? Where did you go to school? Where did you go to college? And what led to where you are today?
Sure. If I were to give like my life in a quick nutshell, I grew up in a small town in southern part of India. And where I grew up, Ayush, healthcare was a privilege, in fact, and I've seen my own family members suffer. My grandmother at age 67 actually lost her foot because of diabetes. Back then, there was lack of awareness, lack of care, and the way people suffered really had an impact on me. And then when I was growing up in the small town and when I was a teenager, that was the first time I've also experienced coding, technology, advent of internet. And the first time I coded, I thought technology was magic. I was wowed. And as I continued, I came to the US to do my master's in computer science and worked extensively in the last 25 years, combination of healthcare and tech. And as part of healthcare, I visited public and private hospitals literally around the world. You name a country, Brazil, Germany, all over US, Asia. And there are a few problems that plague the entire healthcare world globally is access issues to be able to get the right physician in time for the right care and to making sure that the care is actually personalized for the patient or not have been like the biggest issues that I've seen. And given my love for technology, I've always wanted to converge technology and healthcare.
Great. So tell us more, around the years that led to RhythmX and, what led you to the idea in more detail. And then, how did you start your building blocks around RhythmX?
Sure. In the years leading up to RhythmX AI, I've led global operations for 170 countries at Walters Clover Health, where we've developed software for clinicians to use. And that's when I used to travel to different parts of the world, public, private hospitals. And it was number one is when our customers, and in this case, clinicians, were actually telling me how our software actually not even impact lives, but save lives in some cases. For the first time in my life ever, Ayush, I had tears in my eyes. I was like, wow, something that we can do leveraging technology has such huge impact on human lives. Life never felt as purpose driven for me before, and after that I've decided rest of my life I'm going to dedicate to improving healthcare. That's the cause and purpose of my life. And then I was at Nuance for a couple of years where we developed AI solutions for clinicians as well. And given my love for technology, I was amazed by how much AI can actually do for healthcare, changing the trajectory of access issues and quality of care issues, right? And then 3 years prior to founding this company, I was the chief product officer of Humana, where for the entire Fortune 50 company, I've led all products ranging from chronic care, utilization management, care management, pharmacy, and I've also led customer success for Medicare, Medicaid, and commercial. And I used to actually visit patients at home. I used to visit health systems all over the US. And what actually struck me is we are headed towards a crisis in slow motion in healthcare. I call it a crisis in slow motion because during COVID, millions of people were dying right in front of our eyes, and the entire ecosystem came together, acted very quick, and solved for it. But in case of chronic conditions, you're not going to see millions of people die in front of your eyes today, and New York Times and Wall Street are not going to show it on front page. But guess what? It is a crisis of similar, if not bigger magnitude, and there are not enough physicians, and the population is increasing and aging. And you put all these things together, we are headed towards a crisis, and we have to move with a sense of urgency. And then came the boon of the generative AI, and Symphony AI Group has been dedicated to, and we go by SAI Group, has been excelling at AI, in excelling at various industries. And when I had this opportunity to work with our chairman, Dr. Ramesh Wadhwani, who's an extremely successful serial entrepreneur, where the combination of taking intense data, capital, AI assets to solve these healthcare problems, it's an opportunity of a lifetime for me to be able to say, how do we take the latest AI to be able to solve some of these deep rooted problems in healthcare?
Great, great. And tell us in a nutshell, what what RhythmX do. So, if you were to explain it in a layman language, 2-minute pitch, please do.
Sure. So our company's name is RhythmX AI. And In a nutshell, I'm trying to think about how you said layman's language, because sometimes I start sounding like a doctor and I have to get back. By the way, I'm not a doctor. Is Say patient Deepthi went to see her primary care physician. This is one example. I may have 10, 15 minutes, if I'm lucky, 30, 45 minutes, depending on my complexity, right? And there could be, in one case, some conditions I may already have, but I don't have any symptoms. And unless your physician orders certain labs or orders certain images, it's like you don't even know that I
Right.
have it, right? And if you actually let me leave your office without checking for those, these are irreversible chronic conditions. So
Mm-hmm.
by the time I come back next year to your office, I progress to the next stage and I cannot come back to this earlier stages. Some of these conditions
Yeah.
are irreversible.
Right.
And there are thousands of conditions like that. How is a doctor going to parse thousands and thousands of data variables about me to be able to say, you have zero symptoms, but you may have this condition. Let me order this lab. So that's one grouping where RhythmX AI using advanced AI and data will play a key role. And let's think of a second bucket as there are some conditions I, as a patient, already have them, and my doctor knows, and I know it. But out of these five conditions I have, there are two that I'm going to progress very rapidly to the next phase very quickly unless you do this intervention for me. The intervention could be the right kind of medication, the dosage, or could be a certain medical procedure, anything. But again, you do have to look and cognitively look at a lot of latest clinical guidelines, hyper personalized to this patient, Deepthi, and then applying to these conditions to say, Deepthi, out of these five conditions, you have this one thing, we should be worried right away, and these are the interventions needed. And the intervention sometimes may not even be medication. It could be, oh my God, you should go see a cardiologist today, don't delay, right? So it could be any type of interventions. That's one bucket. And the third bucket is, I don't have any condition, nobody knows, but I might be at risk in the future of developing them. And that also takes combination of a lot of longitudinal data, latest clinical guidelines, hyper personalized to thousands of variables to say, you don't have anything today, but you might develop this. We should proactively do these things for you, right? And just saying all these things took me 10 minutes. How are doctors going to do
Okay.
it in like 20 minutes for all these patients, right? And that's where RhythmX AI, combination of a gigantic like clinical expert panel, clinical guidelines, data, everything at the point of care and pre-visit, we put that intelligence at the hands of doctors when they're seeing the patient.
Mm, okay. And where is this data coming from? So you are analyzing the hospital data, you are analyzing the personal devices data, or because the AI model can be only be
Yeah.
as good as the data behind it. So unless it's a secret recipe, if you can share.
Yeah. No, the data comes from almost three different buckets. Some I can't yet get into detail. One bucket of data we have access to is the same SAI Group also has a sister company, Concert AI. So we license Concert AI data, which has access to 300 million patient records, a lot of great data, which you can see in our press releases. The second bucket is we're also building in-depth models per health system. So we don't go broad, we go build in-depth per health system model. So the more health system shares their data, we use it just for that health system, like payer coverage of your patient. So any intervention we show, we know it's already covered for your patient by your payer. That such data would come from that health system or that patient's personal record. So the second bucket is the health system data. And the third bucket is there's so many data sources out there, Ayush. Our team prepared a gigantic grid and we're conversations in clinical, social determinants of health data, claims. There's so much data out there, which we're in conversations with licensing for further depth. So going forward, these are the three buckets we will be tapping into.
Okay, very interesting, very interesting. So, the next obvious question is, how has been your experience with your customers? Like it could be a provider, it could be a private practice. So have they been how has
Yeah.
been their attitude towards technology nowadays, and have you seen a difference before chat gpt became mainstream, or how has been those experiences?
The experiences has been fascinating for somebody like me who's been in healthcare for decades, right? Is number one, I've never seen healthcare industry be so excited about AI. In the last few months, ever since generative AI came out, there is genuine enthusiasm for it. Having said that, the typical good old Jeffrey Moore's crossing the chasm applies even here. You have your own set of whole group of innovators who are not waiting for the entire world to prove it and show every possible risk there is. These are the innovators with true bold mindset are jumping in to be able to say, finally, here is great technology moving at warp speed. Here are big problems. Let me run towards change versus resist change, right? One such example of being a true innovator is Centara Health, who is our innovation partner, about 12 to $13 billion health system based out of Virginia, perfect example of true innovator. And then there are some health systems who I call these mainstream adopters who are waiting in line right behind innovators. They're already telling me, Deepthi, as soon as you have early outcomes come from your innovators, I want to know. I want to be part of this. But as soon as you have them, like ring my bell, I'm going to do it. And they're watching me closely, they're watching us closely. And these health systems, I'd say they're maybe about 1 year away from starting to embrace these newer technologies, but they're watching these innovators. And then you have your whole set of like, not set, I'd say group of laggards who that they will be dragged into change eventually, but they won't run towards change.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Right, right. So, any interesting stories that come to your mind as taking RhythmX to the market, like any interesting questions or interesting incidents that happened that helped you, get a buy-in or get someone convinced, if you can share.
Uh, so what is interesting to me is AI is only part of the equation, right? What really helps get these health systems buy-in is I've had literally hundreds of conversations with C-level, with health systems, part of RhythmX AI, and also in general, part of my thought leadership. I get thankfully invited to several speaking engagements about AI to different forums. So part of combination of everything. And I've been fortunate to be invited to some big board meetings of large health systems to come discuss with them the impact of AI in healthcare, right? So combination of all these things, I would say I've actually recently developed a framework called HEART framework to combine these conversation and what's interesting. The HEAD stands for healthcare value in it, Ayush, where don't just look at AI technology to be able to say, oh, here is something AI, what do I do with it? It has to be vice versa. What are your top three problems you are trying to solve? And does this solution actually solve your prioritized pain points to add that healthcare value to you, right? Because as obvious as it sounds, not everyone is doing it. And I thought that was interesting. Got to solve with prioritized pain point. Otherwise, the honeymoon period with AI would wane away. And then the second thing is for E stands for economic value. You have to look at what does it cost me, right? And there's a cost of false positives, false negatives. There's a cost of this, everything you're doing going to justify the tangible value you're going to get years from now, right? That's the second one. A stands for adoptability, sustained adoption. If you ask me what's the hardest problem I've ever experienced in healthcare, it's changing human behavior. Whether it's patient, doctor, it's the hardest thing. And you can change there perhaps if you're fortunate with a lot of effort for 3 months, 6 months, but to be able to have them adopt to your new technologies in an ongoing way is called sustained adoption. If you don't have what it takes, communications and training, the whole 360 aspects to drive that sustained adaptability, don't even touch it. And R in the heart stands for regulation and IT compliance. You know this, given your background, you have to watch out for regulation and make sure you're in the guardrails. And the last one is transformation and risk. With huge transformation comes change management. Are the incentives of these people aligned towards your new AI solution or going against it? Right? Are there operational processes put in place? Are there champions in place? And without all these five elements, you think you're ready for AI, but you're not.
Right, right. No, very wisely said. I think it makes so much sense. You should really publish this out. I think it really makes so much sense. And health is always about like managing these five pillars or these different aspects of the whole value chain. So, in fact, that intrigues me. You mentioned risk, and I personally have invested a lot of time, around IT risk. So, I wrote a book called Zero Hiccup Way. So, this is one of my favorite topics, like how to manage risk while pursuing something very ambitious. So, how has been your experience with
Yeah, first of all, thank you for writing book. We need more of people like you who've done it with great experience, share your learnings like you did, Ayush, with the industry, because that is going to be critical for millions other people to learn from these kinds of collective wisdom, right? So thank you. And you've outlined some great concepts in your book. Few things I would say is, as your experiences showed in the book and mine do, this is not going to be easy, right? You have to be very mindful about all the iterations and hiccups that you could be facing in going forward. And in my experience, what I'm seeing is similar things. Change is coming at warp speed. You look at even generative AI, with every passing week, if not day, uh, things are changing with AI. My own teams tell me, oh, that's how we did it 2 months ago. Now, with this latest advent, this is how things are done. We're talking about days, weeks, and months. Uh, and it's literally moving at warp speed. And there's a lot of leaders right now out there. It feels like to them, change is crashing on their head and they're getting overwhelmed with what do we do, right? And for me, a big thing here is to be able to, people are thinking a lot about what is the right problem for me to solve in the right sequence in a way I minimize risk and maximize value, right? To me, that's where the opportunity lies. Go after some use cases where the risk is lower, but the value is much higher for you. There's lots of areas like that. You look at, in our case with the Max AI, you're giving a extremely advanced co-pilot for physicians. Physicians are still in the driving seat. We are not doing the autopilot. We are not automatically doing stuff to patient. We are enabling the physicians. They still look at it and make decisions. And that would be low risk, super high value for you, right? That's one example, but there's a lot in the healthcare industry like that to lower your risk and deliver highest possible value in the current times.
Right, right. And you mentioned something, previously about, the innovators, the laggards, and people at different uh, phases of mindset. I would say, while they know that they may need it, but someone takes action, someone do not, someone is too
Yeah.
overwhelmed with the risk involved, and so on. So, a very important learning that our listeners could take from could be if you could elaborate more on that aspect in terms of how do you identify like which hospitals or which systems are better suited for AI adoption, which may not be. As a founder, that's a important puzzle to solve when you are taking your product to the market.
Yeah, you're asking me $1 million question, if not $1 billion question, right here, right?
Right. Yeah.
Because there's lots of people out there who say the right things, Ayush, and it takes sometimes the time to see.
And
Uh,
there is a lot of times, founders have to waste time barking at the wrong tree. Like there would
exactly,
be
right?
some people that would always be in pipeline. Like every quarter they may think, okay, I'm going to sell to this guy this quarter, and the next quarter they're still saying the good things, but not probably moving forward.
Yeah. So few things I look for is one is we prepare our ideal customer profile to be able to say, for the problem we are trying to solve, for example, have to have ambulatory practices. You need to have solid primary care practice presence. So you have to look at all the basic stats that you can do even without reaching out to these health systems to be able to say, do they even have the right profile, right? And once they have the right profile, too, I also look at their organization and leadership uh, to be able to say, have they ever done anything innovative in the past? Or is this the first time they're saying they're doing it, right? Their past track record will say a lot about the future as well. What have they embraced in the past, right? And in what phases. So that will be very telling. The third thing that would be for me is who is going to be embracing this? If it is a CEO and nobody else, that's a red flag to me because they're not going to have that level of time, energy, and bandwidth to be able to embrace a solution and do everything I just described in the heart framework, right? It has to be another senior leader below CEO who is actually being a very like a champion for this and who actually has the political capital and enough influence to be able to run with it. And if you don't know who that is, if that is 10 people who are like somewhat interested, time for you to run, right? So combination of all these, you will be minimizing your risk of putting too much energy into the wrong health system.
Right, right. No, makes sense. And another thing that I wanted to know today was around, like because AI is so complicated, and today I can see that RhythmX has been able to take some of the right direction, if I may say, and a path that you've carved for yourself, your customers can agree to it. So my question is like, if someone is interested in using AI to personalize patient care, you are doing it for chronic illness, someone wants to do it for some other use cases. What are those key steps that one could take to design an AI system that achieves a similar level of personalization? So, what have been your lessons that you can?
Yeah. In addition to everything else I've said, right, about do you think you can drive the sustained adaptability? Data quality is very important because at the end of the day, garbage in, garbage out,
Right.
like all the obvious ones,
Right.
in addition to all the obvious ones, I will say one big thing advice I would also give is user. You could have all these buyers who are your CFOs, chief clinical officers, everything, but at the end of the day, who is going to be using what you develop on daily basis? How much do you understand their everyday life, right? For example, for us to design even our product, minimum 1 full week a month, I'm literally sitting in the rooms of these doctors doing observation sessions and doing user feedback sessions to be able to truly understand what is their workflow, not by reading some industry report, but are you where the problem is happening, right? And not just you, I mean you as a founder, but are your product people there, are your engineering people there? And at the end of the day, the minute you start deviating from what these users need truly, that day your product is will start getting outdated, right? To me, it's that critical.
Mhm. And I'll end this podcast with another thing that stood out from your journey, and you mentioned about it as well. Deepthi, is your collaboration with the SAI Group, the Symphony AI Group.
We
So
call
how
it
has
SAI Group.
Okay. Okay.
SAI.
SAI. Thank you for correcting me. So, how has been that collaboration? And I know, from my own experiences as well, that, collaboration is a very important component in health, especially, the way the industry works. So, how did that work for you? And again, any lessons that you can share regarding the same?
um, that has been our greatest asset and amazing number one collaboration with our chairman too. Like I said, Dr. Wadhwani, who's been a serial entrepreneur, has built many companies literally from zero to billion-dollar revenues, right, in the past. And there's not that many entrepreneurs who've done it in repeat basis. Tremendous success. And having his mentorship on regular basis and his collaboration is one gigantic assets for us. Capital, of course. In addition to the $50 million to RhythmX AI, he also pledged AI into AI $1 billion for his
Okay.
portfolio companies. That's gigantic investments, so capital. And then the AI powers, we have Eureka AI platform, which has about 1,000 AI engineers and data scientists working on it, that I've licensed as well. So my starting point is very different than a typical startup. And the data collaboration between me and Concert AI, that licensing helps us with data as an accelerator. So in the current day, to be able to run fast and add a lot of value, what more do we need other than these accelerators?
Right, right. Do that. Well, thank you so much, Deepthi. It's been a great conversation and, a lot of takeaways for the listeners. And I think, the niche that you've carved for yourself, I see it all, taking shape, and we wish you all the best on your journey.
Thanks, Ayush. Totally enjoyed this conversation. Appreciate it. Thank you. Bye.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.